To the extent that we live our lives in a manner that is consistent with the truth in our heart, we thrive.
Welcome to the Meier Clinics podcast, and you just heard a quote from one of your hosts, Dr. Lisa Day. Join our licensed clinical professionals from various backgrounds as they discuss fascinating mental health topics with a wide range of guests. Meier Clinics is a Christian counseling organization with multiple clinics nationwide dedicated to treating the whole person, emotionally, physically, and spiritually. Welcome to our listening family. We thank you for joining us. Hi, everyone. Kristin Walker here, and I am hosting another show. And we've got several people on the show. We have Dr. Lisa Day, who you've heard many times with me. Hello, Lisa.
And good morning. I always mess you up with the good morning part, don't I? With our time differences. Sorry about that.
It's fine. You never know when someone's listening. And we also have Dr. Paul Meier with us, who is on many shows on our network, but and every so often on the Clinical Christian. Hi, Paul.
Hello, everybody there, and hello to the listening family. We appreciate you tuning us in, and I hope this program is real helpful to you today.
Absolutely. And we also have Grant Davis with us, who's been on the show before as well. And so, Grant, thank you for joining us today.
Yes, thank you for having me.
So we're going to talk about, I love this topic because it's just so widely scrutinized. There's a lot of stigma around it, and there's certainly a level of fear, anxiety, intimidation. People get very hot-headed about it, and it has to do with ADHD and medication for ADHD. So we're going to talk about the upside and the downside of ADHD medication, and just have we're not saying a pro or a con about anything. We're just delivering information in the way that these three wonderful people in the behavioral health field can do. So, Lisa, I want to start with you. Let's start with, why this is a topic that's important to you and why you wanted to do a show like this one.
Sure. Well, the reason I'm interested is because of the prevalence and then the increasing prevalence with accurate diagnoses with folks with ADHD, both children and adults. And we know that currently there's approximately 6 million children and 10 million adults that are diagnosed, that know they're diagnosed with ADHD. And while many of those kids will theoretically outgrow their ADHD, about 60% of them continue to struggle as adults and therefore continue to need treatment. And so my wanting to do the show is that though we know that pills don't substitute for skills, we need the therapeutic component, it's looking at what are the upsides, what are the advantages, what are the response rates, for the psychostimulants, and then what are some of the challenging side effects that often can discourage people and cause them to withdraw from a medication trial and not be able to, actually experience the benefits. So the reason I'm wanting to look at this is because of the high prevalence and then the increasing prevalence of accurate diagnoses, and then how to help folks figure out, with the proper medical care and the proper practitioner, what's the best medication regimen for them.
Yeah, and I love that we have Grant on because you're our resident expert on the medication piece. So Grant, just for any listeners that haven't tuned in yet to you either on Mental Health News Radio or the Clinical Christian, give a little bit about your background and why you're the medicine man.
I just have a lot of experience with treating clients who either have ADHD as the primary diagnosis or is definitely a comorbid or a co-occurring mental health problem. And you often see that with people that have depression. They also have a co-occurring ADHD problem. And a lot of times in my experience in treating people who maybe haven't had treatment with ADHD until adulthood, a lot of some of the symptoms of depression and anxiety can really come from a lot of low self-esteem that comes from untreated ADHD and kind of a history of failure in a lot of areas of life. But I just years of experience and study on how ADHD affects the brain and how these medicines affect the brain. It's kind of my background with it.
And I know, Dr. Meier, you've said this before, that you go to him often to say, hey, what should I do here? So talk a little bit about that, just because I like for people that, our listeners that aren't practitioners themselves, that are people struggling with this, to hear the very human side of a therapist. So many people forget that therapists, whether you have a PhD, an MD, an LCSW, whatever, they're human too. So I love how you describe things in that way, Paul.
Yeah. Okay. Well, Grant Davis is a nurse practitioner, and he prescribes medications and for different things, and he treats a lot of people with ADD. I'm a psychiatrist, and I also treat a lot of people with ADD. And I want to say a couple of positive things, but there are pros and cons to it. Let me give you just a few ADD traits for those who are listening who may not know what ADHD even is. People with ADHD tend to make careless mistakes when they're doing boring projects. They have trouble keeping their attention when they're doing boring projects. They have trouble keeping attention to what people are talking to them about. They have trouble wrapping up the final details of a project after they get the hard parts done. They may have trouble organizing things. They put off getting things started. They misplace things quite a bit. They're distracted by activities or noises around more than most people. They may forget appointments or obligations. They tend to fidget or squirm with their hands or feet when they're sitting down for a long time, or feel restless or fidgety. And I'm not talking about just for the past month when you're going through stress, but I'm talking about lifelong. They, if they get stuck in traffic or have to wait at a restaurant, it really bothers them a lot. They'd rather drive a lot further and not have to have any red lights. If somebody's talking to them and can't think of a word, they butt in and finish the sentence for the other person. They tend to talk too much when they're in social situations, and that's pretty much it. Those are ADD common ADD traits, and if you have that, people are born with that, and it's a real handicap. And when we start somebody with those traits on an ADD medicine, it's life-changing for them. We have college kids that go from a C average to an A average on it. But Grant's going to tell us in a little while about people that don't have ADD when they take, in fact, I just read that. I read up a bunch of stuff on WebMD yesterday and today too. That's where doctors go to find out the scoop. That people, actually, it can hinder if they take medicine. So a lot of college kids that don't even have it get stimulants to help them study, and it might hurt them. But here's one positive thing that I got from WebMD. People with ADHD who are treated with ADHD meds have a lower rate of substance abuse than people with ADHD who are not treated with ADHD meds. Now, people who are on ADD meds might have a higher rate of substance abuse than people that don't have ADD at all, but people with ADD who are treated have a lower rate of substance abuse because they succeed and they don't want to numb their feelings out. The ADD stimulants are not addictive. They're not even habit forming in the doses that are prescribed by Grant and I, WebMD says. There are no significant negative effects of long-term use of stimulants as prescribed in people with ADHD, and the benefits far outweigh the slight risks. There are side effects that we'll get into, and so those are just positive things that it can be life-changing. I remember one time a couple brought their child in my office when I used to treat kids and for ADD evaluation, and he climbed up on a chair and spun around and round and round on it, and then wouldn't stop. And then he ran over to my drapes and tried climbing up the drapes up the window. And back then we could give them a sample. You can't do that now. You'd go to jail probably if you do that now. And so I pulled out a tiny little dose of Ritalin and said, "Do you mind if I have him try this?" And so I gave it to him. And while the parents and I were talking, about 5 minutes later, he was sitting down calmly saying, "Yes, ma'am. Yes, sir." the parents practically fainted, because they can have the difference. So, okay, that's my little opening.
But you know what's interesting with that, Paul, though, as well, is that I think that's the profile that many people think about with ADHD, that it's a kid, swinging from your curtains or jumping on your chairs. And, just to chime in that more and more we are recognizing the young woman who sits quietly in the corner and doesn't disturb anything and sits, very politely, and she looks like a well-behaved together young woman. And what we're discovering is these young women actually are having an inattentive form of ADHD, and inside their minds, they're terrified to go to the lunchroom because they're overwhelmed. And so what looks like shy, collected behavior really is the other form, the inattentive form of ADHD. And we're getting better and better at being able to diagnose that and therefore be able to treat that. So we have both.
That's a real good point. Lisa, I read about that too, that lots of times it's missed. Statistically in the research, male and female children, and that surprised me. I found out just today, have exactly the same percentage of ADHD, or at least ADD. But in girls, maybe it's because of the androgen in boys, but in girls, often it's just like you described it. They have those distractibility symptoms, but they may not have the hyperactivity symptoms as much. And so they may do poor in school, even though they have a high IQ, because they're distractible. They're looking out the window, and the teacher asks them something, they forget what the teacher's talking about, but on medicine they do great too if they have legitimate ADHD.
Well, and so that would launch me into a question that I would have for both of you, Grant and Paul, and that's, when you do have a presentation, and I'm thinking in this question here more with the adult population of, how do we know where to start? Because we've talked about in previous episodes that when you get a dual diagnosis, Grant, and you spoke to this just a few moments ago, someone presenting with depression and ADHD symptoms, one might think to start on a Wellbutrin, a bupropion. But when do you decide you would start on a Wellbutrin versus a methylphenidate versus an amphetamine? So Wellbutrin versus Adderall versus Ritalin. How do you begin to differentiate that as a practitioner?
That's a very good question. What I try to do, and it's not easy, it can be tricky, is to see, with their, say a patient presents and they are depressed, and then a lot of concentration difficulties, trying to sort out if the correlation between is a lot of the depression coming because of failures in certain areas, and what I will often see too is a lot of anxiety in those patients too, and so trying to figure out is this person a worrier? Do they are they just thinking about worrying about a lot of multiple life events, and so that's why they can't concentrate? Or is a lot of the worry and the depression, is that coming from things that they're not getting done? Is it our marriage is falling apart? My wife tells me I don't listen. I can't sit down to enjoy anything. We try to watch a movie, and then I'm in the kitchen doing something. I'm about to get fired. I can't keep up with my work. I'm constantly asking for extensions on these reports. I can't find anything. My organization is so poor. I let the electric bill lapse. I forgot to pay it. Really trying to figure out how much is, could it be untreated ADHD that is causing a lot of the problems versus a true, this is a major depressive episode with co-occurring ADHD. It's not easy. If you can get a sense that a lot of the problems are coming from an untreated ADHD, if it just really looks like that, sometimes we'll start there. But a lot of the time, I always prioritize mood and a generalized anxiety or a panic disorder or something like that over ADHD. And it just some safety. But the thing is when we can get that better, I want to see what's left in the concentration. If they say, oh my gosh, my mood is a lot better, my anxiety is a lot better, I still can't concentrate to save my life. Okay, then we're dealing with a kind of a multiple pronged diagnosis. But if we can really get a handle on, what I really think is untreated ADHD, the cool thing about treating ADHD is we know pretty quick because the medicine works immediately. You don't have to wait several weeks like an SSRI, an antidepressant or something like that. You'll know within a few days. And a lot of times if the ADHD is causing a lot of the other problems, they'll come back in a week and say, oh my gosh, my anxiety is like a zero. I'm getting my stuff done. I'm able to listen. I'm able to engage in conversation. I didn't zone out in this meeting and then embarrass myself. And so pretty quick that it can be the advantage of trying ADHD first. And it's pretty life-changing. And if it's not life-changing, that may be that it's not ADHD.
So Grant, I have a question with that. So if someone presents, so as a clinician, when someone presents with severe anxiety and it looks like it's secondary to, as a clinician, you're thinking it's secondary to the ADHD process. And lots of folks would report to me that it seems counterintuitive to put someone with severe anxiety on a stimulant. But am I hearing you correct to say that when you put them on that stimulant, actually that will calm the anxiety down because they're better able to utilize their brain and they're better able to follow through with tasks and activities?
Absolutely. If you can make, as a clinician, if you can make a good assessment that that's likely where it's coming from. If it is a separate problem, it will often make the anxiety worse. If you can
let me get in here for a minute, and I want to give something I do that makes it a little easier for me. When I do an evaluation, I give every single one of my new patients an ADHD, the World Health Organization ADHD test, which only takes about 8 minutes to take. It's basically those questions that I mentioned. I mean those ADHD traits. That's basically the test that I was looking at. And but I ask them, I want you to answer these questions, whether they have that never, seldom, sometimes, often, or very often. And I want you to answer it according to elementary school, junior high, and high school, as well as now. I don't want you to answer it according to how you feel now when you're going through depression and anxiety. So if they've had those symptoms in elementary school, if they've had them all their life, then I know that they have ADHD if they score a certain score on it, and I'll see how severe it is. And if they haven't had them growing up, but they have them now, then it's not ADHD. It's all anxiety related and due to their current crises that they're going through. So if it's lifelong, then I would start them on a stimulant. But if it's just recent, then I wouldn't.
That's helpful. Very helpful.
That can absolutely help. The thing is too is that if someone's had a lifelong history of anxiety, it can still muddy the waters. And so those screening tools are absolutely helpful. But the other thing with just the screening tools is, if you could make that just if you just wanted a stimulant, right? So Dr. Meier obviously definitely does more than just go based on the what that screening tool is, because anybody can go in and do a screening tool and make it. Oh yeah, I struggle with all these all the time, and since I was a kid. So it's definitely more than just a screening tool, but that absolutely helps. In asking, follow-up questions to those screening tools.
So I have another question. Once you decide that you're going to medicate, with the ADHD, and you've decided to go with a psychostimulant, and from my understanding, there are two main classes of psychostimulants. There's the amphetamines, which we know as Adderall or Vyvanse, the most common ones, and then there's the methylphenidates, which are commonly known as the Ritalin and Concerta, just to name a few. When you've decided, okay, we're going to try a stimulant in this person because clearly they either have ADHD or we speculate that it's secondary or underlying the anxiety or depression, is there a key or is there a path to know which one you start with? I mean, it seems as though, obviously there's not a test that we can say, okay, your blood sugar's at 135. How do we know which one, or do we just try one that we've seen the best results with? How do you differentiate where you begin once you've decided to use a stimulant?
I tend to, the first question I ask, in the eval is there a family history of ADHD? And if there is, we ask, is anybody else in the family medicated? And if they are, we try to, we find out, oh yeah, my brother's on Concerta and they do great. Then I'll typically start with that. If we don't have it, I've got several family members, they're not medicated, no one in the family's on medication. I usually start with Vyvanse, which is an Adderall-based product or an amphetamine molecule. And start with that one because it tends to be a very smooth, there's no true peak in the medicine. And so that's typically where I'll start with that one. And then just the delivery system of the medicine tends to be to be very tolerated very well. But outside of kind of a family history and genetics of other people doing well on different types of medicines, we tend to, I think, go with what we've seen work well. There's not kind of a and then sometimes we pick ones based on like schedule and routine. Sometimes a long-acting medicine for some people is just not ideal, in depending on certain schedules and routines and different things like that. And so sometimes we make decisions on, maybe a Ritalin would do better in this case, or some of those things. I don't know if Dr. Meier uses a different approach than that, but that's what I tend to do.
It seems to me like they both work equally well. And if a patient, for example, has a side effect on Ritalin and they switch them to Adderall, it seems to work just as good. Or the company, sometimes the company that makes Adderall will run out somehow, somebody not too smart running into place probably. And I might switch them to Ritalin until the Adderall gets back in stock, and it seems to work just as well. So I don't know, it's half a dozen. I don't differentiate which one to try, but I usually start with Adderall. But I agree with what Grant said about, let me tell people real quick about the difference between the short acting and the long acting. When they take Ritalin or Adderall, it works. It starts working in about 10 to 12 minutes, and it lasts for 4 hours. But it starts out just barely working, and then it reaches a peak and works real well, and then it goes back down, and it works better if you don't have any food for about an hour before or after you take it. So if a child took it or an adult, they'd have to take it when they first wake up and then get, shave or whatever else they're going to do. And then if it's an adult, and then have breakfast like in half an hour or an hour later. And with Vyvanse, you can take it with or without food. It doesn't matter. With the short acting ones, you take them 2 or 3 times a day. So it's hard to remember to take the other ones if you have ADD. And with Vyvanse, it lasts 12 hours. So they take one in the morning. They don't have to have, their teacher or somebody else remind them to take another one. They usually give them the other one at lunch, which makes it not very effective because it doesn't work as good with food. And so Vyvanse is a really good one, but it's a name brand. So it's if they don't have insurance that covers it, it's about $300 a month. It's expensive, and so if they don't have insurance, then they would have to do Adderall or Ritalin, which are probably about $30 a month or something.
Hi, this is Dr. Paul Meier, founder of the national chain of Meier Clinics. I've often told you about how people just like you are getting the healing that they need from emotional issues like depression, anxiety, anger problems, and relational problems. We wanted to share with you Mickey's experience at our day program and how it has affected his life.
The Meier Clinics has been a real blessing to me. Dr. Meier told me that people get well here, and my life has been completely changed. I have been symptom-free for 3 years, and I'd recommend it to anybody that really wants to overcome an emotional problem of any kind.
Mickey's story is like so many others that we receive. It's an encouragement to us, and we hope it will also be an encouragement to you to call us to get the emotional help that you've needed. Please call toll-free 888-7-CLINIC to be connected to the Meier Clinic program nearest you. That's 1-888-7-CLINIC, or go to meierclinics.com. That's www.meierclinics.com.
Yeah, there is a coupon through the makers of Vyvanse that you can get. I use it, even though I do have really great insurance. That's the one that works for me. And my copay, my copay was going to be about $80, and I for a 30-day supply, and I went to the Vyvanse website, which I think it's Vyvanse is how you spell it, correct?
Yeah.
Okay. You can go to their website, you can sign up, there's a coupon. And if you go to places like Walmart or, other, CVS or whatever, they will add that to your profile. And that way, even if, you have insurance, you still get that deduction, which dropped my copay for it to about $30. And I remember
it's supposed to drop it to $15, actually.
Is it? Wow.
You might
I
want
need
to look
to talk to them.
It's supposed to be $15 a month, but you might need to look one or two more places.
Oh, okay. Thank you for letting me know. These are important things for people to know.
Sure.
I remember when I started taking Prestige, and it was not covered because it was brand new, and I was spending $387 a month for it. It was not covered on my Blue Cross Blue Shield. Now it is, and I think I spend $10, but listen, that when you need medication for your, and for your mental well-being, I just made it affordable. I ate ramen. I did whatever I needed to do. But boy, was I glad! Boy, was I glad when it was finally covered on my Blue Cross Blue Shield. So yeah. Those things are important to know.
Yeah. On my ADD test. On my ADD test, I took it myself, and I scored twice as high as most of my clients that I treat for ADD. So I've got really bad ADD, and so Vyvanse is supposed to last 12 hours, but it lasts about 7 on me. So I take a Vyvanse in the morning and an Adderall in the afternoon, and I literally get twice as much done because I do have severe ADD. I literally get twice as much done on the ADD medicine as I do without it. So for me, it would be a sin for me not to take it, because I can be two Dr. Meyers here instead of one by taking ADD medicine.
So how do you? I've had people say this to that question, or to that statement, that you're using a supplement like kids do in school that don't really have ADHD, and they're using something to study. How do you answer that question when people question that? Like, well, you're just using something to be more productive. That's not really helping you with. I've actually had people say that to me, and I didn't really know how to answer them other than, why don't you get a little more informed and listen to our podcast? But I want to, put that out there to the listeners about answering those kinds of really stigmatized and ill-informed judgments people have about someone that takes this kind of medication.
I like to think of it as a water balloon. And that when we have medication, I know it sounds strange, but when we have medication, we have a water balloon, and our water is contained in the area where we want it or how we want to use it. Mm-hmm. And that when we come off medication, it's like the water balloon popping. Water just sprays everywhere. And so when people say, what do I just take this, as a cocktail, if you will, to feel good when I need to? I said, no, but when we need to hold your thoughts in a particular manner and be able to direct them in a particular space, perhaps we would say a hose is a better analogy, but they were able to direct that water through a hose or contain it in a balloon versus it spraying out of the spigot, uncontrolled, undirected. But there's a lot of stigma attached to that, you just use it so that you can do X, Y, and Z. And yes, we do use it so we can do X, Y, and Z, but it's because unattended, the thoughts are overwhelming and bombarding. The chatter, right. That cognitive chatter is so distracting.
And just a general sense of well-being that I feel, it's very much like taking antidepressant medication, only in the sense that I feel like and I know it's hard to classify normal, I put that in quotes, but I get the feeling of, this is what it feels like to be someone that does not carry or does not walk around with their feet in concrete blocks every day trying to just get through life. I have genetic, I've done the genetic testing on myself. I have ill functioning neurotransmitters. I need this kind of help. And all it does is raise me to the level of how I would be if I was born with a brain that functioned the way that a normal brain functions. Does that make sense, or am I saying that wrong?
It makes sense.
If a happy person takes an antidepressant, it doesn't make him any happier. That's
right.
a myth that people have. But if your serotonin is low because you inherited a low serotonin level, and so you're depressed chronically, and you take an antidepressant, it helps you to be your normal self. What you're like on the antidepressant is the normal you with the normal amount of serotonin. And Grant, you were telling me, and I read it in WebMD this morning too, that people who don't have, people with ADD, if they take an ADD medicine, it makes a dramatic difference. But people who don't have ADD, it not only doesn't help, but I was surprised to read that it can even hinder them. What do you know about that?
It absolutely can.
Question.
I think you see these, one of the reasons these drugs are Schedule 2 or the DEA monitors them so tightly is because of their use and sell on college campuses. And what you'll often find when talking with people who've used some of these medications to help them study, when people don't have ADHD, they're not getting the benefit that they think that they are. I think primarily what people like about them is that it gives them a sense of alertness, and so they're able to stay up all night and study. But what you'll often find is their outcomes on tests are not any better. Waiting to the last night to cram for an exam, you don't do any better. When someone has ADHD and they take their medication, they're actually able to retain what they read, as opposed to when they're not on medication. It's like, I just read 3 pages and I don't remember anything. Or you're thinking about, what you're going to do the next day while you're supposedly reading or studying. And it's not really, it's not the primary, but the pathophysiology or the disease process of ADHD is largely a lack of dopamine to key areas in the brain. And that's what the medicine does, is provide that dopamine where it should be to make it essentially like you don't have ADHD, to make your brain function as if somebody who doesn't have ADHD. I don't have ADHD. If I took a stimulant, it'd just wire me. It wouldn't help. It probably would hurt my concentration. I would be more hyperactive. I would be bouncing off the walls. But you give somebody who does have that neurochemical disease process of ADHD, it's going to slow the brain down, help them to pay attention and focus on what they're doing and to absorb and retain. My pastor will refer to illness a lot of times as, we live in a Genesis 3 world where we have disease and illness, and that's physical and mental. And the goal of these medicines is just to get the brain back to the way it was originally designed to function. And yes, and that's what these medicines do. Can you take enough? Can you take a ton of medicines to get a euphoric effect? Absolutely. You can do that on a lot of different medications. That's absolutely not the goal, or what we prescribe it for. And people take these medications that don't really need them, and their perception of the benefit, I think, is probably very skewed, and not helping them like it is someone who has ADHD.
One of the things that I observe, and I would be interested in your input on it, is that in my practice, oftentimes the question will come up, do people become stimulant addicts, when they're taking Adderall? And one of the things that I note, Grant, just on what you're saying, is that I see a higher likelihood of developing an abusive pattern and then an addiction to Adderall or the stimulants when one does not have the ADHD diagnosis, but in fact is using it either for weight loss or the study drug or for recreational drug use. And what I understand is that because they don't have a dopamine deficit prior, they get a surge in the dopamine, but then when it drops, they have a craving for that increased pleasure. And so the drive to use Adderall is greater in an abusive pattern with someone without ADHD, whereas as Paul was talking about earlier, with those who are properly diagnosed and properly managed on their medication, it's going to decrease the likelihood of abuse and therefore decrease the likelihood of addiction.
Absolutely. And what I think a lot of the studies show is that well-treated ADHD, decreases the rate of substance abuse problems across all drugs in a lot of ways. And, I think that there are some, don't know the statistics completely, but, I think what I would remember reading is that untreated ADHD, specifically in teenagers, there's about you have a 2 times higher likelihood of trying drugs because of the impulsivity. You have a 2 to 3 times higher to get pregnant or get someone pregnant, and you're 2 to 3 times more likely to be involved in an automobile accident with untreated ADHD. But specifically that, it's this impulsivity of trying things and not thinking about consequences. And I think that there is a sense, because all drugs of abuse, whether they're stimulants or downers or opiates or whatever they are, is that your reward, your pathway system is dopamine mediated or controlled by dopamine, and so you're trying to get that dopamine, and most of the time people with ADHD, the stimulants don't give them the response that they want, and so they often don't abuse those or get a high from them.
It's very, very, very dangerous. People that abuse Adderall or any of the ADD, any amphetamines, it's one of the worst things you can do for your brain. Maybe even worse than heroin and things like that, because it can cause permanent, biochemical problems and brain damage, and there's people that buy a whole bunch of Adderall and they'll crush it up or they'll snort it or do different things. And so I don't want to downplay the dangers of amphetamine abuse. It's extremely, and it makes it more hostile and get in fights and And it's just horrible.
Well, and when one presents with a substance abuse issue, and then we find that they have ADHD as well, it's my understanding that the protocol is that we first want to address the substance abuse issue and then address the ADHD, because they're at such a higher risk of taking that treatment and then abusing it if they have an active substance abuse on board. But that's tricky, so we're trying to help this person become sober, if you will. Meanwhile, their dopamine deficits are a part of their alcohol cravings, but we have to get them sober and clean and some mileage there before we can then come in and address medically or medication wise the ADHD. So it's tricky, but I know that we're finding that the representation of undiagnosed ADHD with alcoholics, it's huge. I mean, I think 25% higher, with undiagnosed ADHD, not folks having a substance abuse issue and not having any idea that they have ADHD. And so,
Yeah. I found it really fascinating working with a nutritionist and who's also a mental health counselor and doing this really interesting genetic test that focuses on what your markers are towards substance abuse, which substances. It was fascinating, and I thought it was really interesting. And ADHD showed up, of course, all over the place for me. But what I thought was fascinating was a conversation around, okay, so when I've had problems with alcohol, wine specifically, it was around me having 3 hours of my day where I felt what it felt like to have a general sense of well-being. I felt happy. I felt just at a base norm because of the wine, because of the dopamine deficiency. And to realize that, that's why I was running towards that. And with taking ADHD medication, I don't have the desire for that because it's being taken care of in different ways, plus, the right antidepressants. But we just don't really know as a lay person what all of it means. And so that's why it's so important to do these shows where people can really understand, there's a lot that goes into this family history, what your genetic code is, behavioral, all those things.
Well, and Kristin, when you were speaking earlier about being off medication and then discovering medication, it brought me to a question that I have for you as well, for all of you, is that, ADHD across the lifespan, in different medications and different doses. So I've observed in my practice, folks who have been placed on let's say a Concerta when they're 8, 9 years old and pretty significant doses, 50s and 70 milligrams, high doses. And then when they go through puberty, their reaction, they emerge with these side effects. I had one client who had been maintained on a Ritalin Concerta protocol for years. And then when puberty struck, we began to see what looked like manic episodes. And in fact, that continued to develop to where this young woman is now diagnosed with both ADHD and bipolar disorder. And so my question for you guys is, how do you medicate that? So you have someone who's got manic symptoms that seem to be secondary to a stimulant. This young woman was taken off the stimulants so they could deal purely with just the bipolar, and they put her back on an atypical antipsychotic. I believe it was Seroquel. And so they were able to get her manic thought processes back in line, but then she really continued to struggle with very severe ADHD symptoms. How do you approach something like that?
Bipolar and ADHD are kissing cousins. And it seems like, and I treat a lot of people with bipolar. It seems like the vast majority of the people that I treat for bipolar also have ADHD. Now, most people with ADHD do not have bipolar, but a higher incidence of people with ADHD have bipolar than the general population. And it's right. It's true that if I have a bipolar patient and I don't have them on enough of a mood stabilizer, and I put them on a high dose of Vyvanse or Adderall or something like that, it can trigger a mania. And so I don't give them ADD medicine if they're bipolar unless they've got an adequate amount of a mood stabilizer like Lamictal or Seroquel, or something like that. And then I'll, give them a little lower dose and see what's the lowest dose that'll work well without giving them. In other words, it won't trigger a mania if they're on a mood stabilizer that'll prevent the mania.
Mm.
So it speaks volumes that it really takes a lot of work, in patients. One of the things that I educate my clients to is that, finding the right medication combination and finding the right practitioner to work with you, it's not simple. What you guys are describing here and in this situation that I experienced with this client is it's not as easy as an insulin, right? It's not, okay, your blood sugar is here, we're just going to give you this much insulin. And even though you have to test your blood sugar regularly and adjust, accordingly, I think that when we're trying to do the dual diagnoses, whether it's a depression or a bipolar combined with an ADHD, it can be months of finding the right medication combination. And I wonder, how many people we lose, in that process because they get frustrated that my ADHD
Right.
medication made me have a manic episode, screw it, I'm going to go back to drinking. And,
Right.
just the more we can educate folks that it is a challenging process and it is a long process. There's not a cookbook recipe. It's more trial and error. But I'm wondering how you see the need for, or do you see medication dosages or the type of medication that's needed? Do you see that to change across the lifespan of, so when one goes on medication when they're a child and then as they move into adulthood, do you find that the amount they require goes down, or do you often change that medication? Is there any formula, or is it just based on case by case?
Mine is typically case by case. Timing and if they're an adolescent or a teenager with usually very low insight just due to age and maturity, just really relying on what parents are seeing and then asking them frequently to get teacher feedback on how things are going in school, but yeah, primarily case by case and just life changes after life changes. And I'll have people say, hey, I needed a higher dose when I was doing school and work, and now I'm just in work. Can we lower my dose? And so, just patient, when they have more insight and older, just patient report on how they think the medicine's doing and how long it's lasting and things like that.
The other thing that I notice, and I don't know if there's a way to address this from the medication standpoint of view, but I often will get complaints from clients, and these would be female clients, that premenstrually, they feel that their ADHD medication is less effective. Is that something that is accurate, or could that be a perception, or do you see that from the medical end?
I can see, I actually have had that complaint a couple of times, and it absolutely could be perception. I think that there probably is some hormonal changes that just make concentration harder, period, premenstrually, that may not be like a true neurochemical ADHD problem, if you will, but just how that can affect. I mean, some people with that premenstrual disorder, anxiety can go through the roof, premenstrual, or they can become very depressed. So it could definitely a hormonal effect that can just make it seem like it is just really hard to concentrate even on medication.
I did read somewhere in my journeys that as estrogen goes down, that ADHD symptoms can go up. Would one ever supplement with hormonal creams, or is that just something that we learn to go, okay, I'm premenstrual, it's going to be a bit more challenging, or is that addressed? I mean, I'm wondering if that's just something we educate our clients to or educate ourselves to, that the symptoms can be worse there, or is there a way to supplement hormonally or what have you to navigate that?
I always recommend, depending on how distressing or disturbing or how much it interferes with the day-to-day functioning, is when I will recommend like a supplementation with hormones. So if a patient's saying, I notice this happens, and it's just a little bit harder, I have to try a little bit, they're able to overcome it, or it's not super bothersome, does not affect their day-to-day, then I say you have to weigh that out. You have to weigh out how much it affects you. If it is something that's pretty severe and significant and it is hormonally driven, I will definitely recommend that they follow up with OBGYN or the someone to manage hormones. I absolutely think in situations that is a necessity, and I do have clients more so on the maybe treating anxiety symptoms. It's where I'll see it more, is that anxiety will really spike premenstrually. And so I'll tell them, hey, I'm going to do what I can on my end from the psychiatric medication standpoint. But if this is not helping you, you're likely going to have to follow up with and try some hormonal.
And we don't we don't do the hormones ourselves, of course, but we like Grant said, we refer them to an OB-GYN. But another thing that I would do in a situation like that is if they have really bad PMS, there's a couple of antidepressants that get rid of pain as well as depression and anxiety. And so like Pristique and Cymbalta, and Grant told me a third one, but I forgot what it is the other day. And Fatzima. And then there's Lamictal is a really good anxiety medicine that also gets rid of pain, and Topamax is a anxiety medicine that gets rid of pain and also makes you lose weight at the same time. So some of the gals and guys like that one, but if a gal's got PMS, I might add one of those or two of those to prevent the PMS from bothering them, and then the ADD medicine would work all the way through the PMS usually, but they may need hormone treatment from their OB-GYN too.
Basically, what we're saying is there's a lot of factors to this.
Yeah.
The goal of today's show was to really get into, as much as you can in a 50-minute show, what those factors can be, and have people in the trenches that have ADHD and also treat it, and some that have it and they also treat it. Talk about, the back and forth and what this means. I know for me, I'm very conscious of how I utilize it. I don't take my Vyvanse on the weekends unless I have to work. And I'm very careful about the time of day that I take it. And, I'm responsible about how I take it. But and it did take a bit in the beginning when it would start to wear off. I did feel a little more agitated. I didn't behave in an agitated way, but I felt more agitated. And it was great to speak with you, Lisa, and also my GP, and realize, it's just because my squirrel brain is coming back, and I got a few hours without it. And so of course I would be a little agitated that it's back. It wasn't the medication making me feel that way. It was me going, why can't I focus anymore?
Monkey mind, right?
Yeah. So the transition is also helpful to know about, and that's become less over time for me, where I don't have the agitation at all anymore. I just noticed that, okay, well, definitely not on it. It's out of my system now.
Well, that might be akin to water, right? When we're well hydrated, we feel fine. But if we go several hours without drinking properly, we're going to begin to have a dry mouth and be cranky and perhaps get a headache. And one question that I'm presented with often in my clients, and Paul, I think your input earlier about the ADHD screening test that you use would be very helpful. But the question that often comes across my desk is, Lisa, should I be skeptical if I go to a doctor and I'm diagnosed with ADHD on the first visit and immediately prescribed a medication? That's the nice way of saying all they wanted to do was give me drugs. And, from a clinician's point of view, as a psychologist myself, I usually, if I speculate that there's ADHD, I'll say, this is what I'm seeing. These are some symptoms. I'd like you to go read this or go take a look at that. Tell me what you think. I would refer them to some reading, and I warm them up to, perhaps we'd like to try a medication referral or what have you. But what are your thoughts on that question of, should I be skeptical if I go to a doctor? I mean, both of you are in the psychiatric field, so that may not be the same as it is for me. But the whole concept of, I went to the doctor and they just wanted to give me a drug. And I try to educate clients that, at the same time, we don't want you to come 6 times before we figure out that your blood sugar is low and you've got diabetes. I mean, we want to call a spade a spade. But what are your thoughts on that as a practitioner point of view, and how we might help clients who are seeking help for ADHD?
I think some skepticism is good. Just like people go to these pain doctors and they put them on opioids, and that's horrible, because they're just they're being legalized drug pushers, and there's some doctors that treat ADD that diagnose everybody with ADD, and out of all we see about 1,000 clients at our clinic, a day, and at our clinics nationwide, and only about 10% have ADHD, and so I think if I give them that that quiz and they score really high on it, and they've been having those lifelong, then I think I can tell in the first visit whether they have it or not. If they're sort of medium on it, we usually just keep an eye on it. And there's a handout I give them to read up on it, and like you mentioned, Lisa, I've got there's a handout where they can read up on it and get to know a lot more about it, and we can put off that decision. And even if they have mild ADHD, they may want to just get some counseling on how to handle it without using medication. Sometimes even nutrition can help it. I wrote a book called Blue Genes, Genes, and I think it's chapter 10 has a nutrition chapter, and it tells different foods you can eat that build up dopamine. And I've had some patients that there's some vitamins they can get that have those foods in them, or they can eat those foods. And I've got some patients with mild ADHD who don't need medicine if they eat those foods. But there are doctors they'll tell everybody and their uncle that everybody that walks through has ADD, and they put them on ADD medicines. That's a shame. So they should be skeptical. They might want to get more than one opinion.
Absolutely.
Mm-hmm.
Well, thank you so much to Dr. Lisa Day, Dr. Paul Meier, and Grant Davis for joining and talking about a topic that is definitely a hot topic. And we will look forward to covering more of these kinds of questions and continuing to do this incredible show. And thanks to our listening family for tuning in. We hope you enjoyed this podcast. Tune in next time for another engaging discussion on relevant mental health topics. If you have any questions about Meier Clinics, please visit our website at meierclinics.com. That's MEIER clinics.com, or call us at 888-7-CLINIC. Don't forget to leave us a review on iTunes, Stitcher, or any of your favorite podcast apps. And please note that we are a member of and produced by Mental Health News Radio Network, MHNRnetwork.com.